I'm going to show you a powerful technique that I call the breathing reset. So this is a technique that I use for a lot of my patients who are in lower back pain, especially acute lower back pain, pain that has come on suddenly, that there's not too much to be done. The person feels like every movement they take is painful. This is often a way in to calm things down, to permit them to get further on into the stages of recovery. Likewise, if you have neck pain, rib pain, shoulder stiffness, this can be a good technique to reset how you're moving. And so the gist here is that we're going to find the biggest breath that we can using the diaphragm more than the neck and shoulders. So when I inhale, and I'm sitting here, I'm going to lay down in a second. I'm trying to get expansion outwards of my abdomen, outwards to each side, even outwards into the low back. I'm trying to find the biggest possible inhale through my nose I can without straining the muscles of my neck. So I don't want to do this, but let the shoulders stay relaxed. Trying to expand the ribs in every direction as much as possible. Kelly Starrett, who runs the Ready State, he calls this the 1 rep max breath. What's the biggest breath you can take? So if the torso is a cylinder, we're trying to expand that cylinder in 360 degrees. And then on our exhale, we're trying to find our 1 rep max exhale. So let's get all of that air out and get that torso as small as possible, getting full expansion of those muscles. So we're gonna inhale and exhale as big as we can. We're gonna do that 20 times. And so this might get a little heady, you might feel a little lightheaded. We're not gonna worry about breathing slowly yet. What we're doing here is we're trying to drive a ton of movement through the rib cage and the diaphragm and the torso. And so the diaphragm and all of the muscles of the core are intimately connected to the lower back. There's a thoracolumbar abdominal fascia that kind of crosses the body. A lot of times we can have these rib injuries and because we got some stiffness, those ribs aren't moving as we're breathing. And so all we're trying to do with these, we're gonna take 20 breaths, is we're trying to drive as much movement, as much blood flow as possible. So this isn't just some wooey breath technique. We're using our breathing to drive movement into areas that might not otherwise see a lot of movement throughout the day. This is also going to help to drive some oxygenation of the tissues. It's going to change blood flow. It can change how our nervous system and our brain relates to a painful area. So if we can get a lot of movement in, it can kind of help the brain to let its guard down. We can stop feeling like that area is so vulnerable, often if we just provide a non-painful input to it. So there's a lot that's going on here. There's probably some other things that we can't explain very well, but there's a lot of biomechanical basis for our breathing, as well as just, hey, we're getting a whole lot of diaphragm activity, some nasal breathing. And then after we do those 20 breaths, they're gonna be fairly rapid and as big as possible. We're going to do a breath hold. So we're going to let some carbon dioxide build up in our body. We're going to do a max breath hold. And then we're going to do several cycles of our down-regulating breath, where we're going to take a slow full inhale and an even slower exhale. And so we don't have to put a timer on this, but we're going to say 20 big deep breaths in, a max hold on our exhale, and then we're going to take 5 to 10 nice slow deep breaths. That's one cycle of our breath reset. So I'm going to lay down here. So I like to have my feet up. You can have a pillow if you need it, but I'm just going to get in a relaxed position here. And I like to place my hands right here, because as I inhale, I want my hands to go up to the ceiling, but also slightly outwards. And I also want to feel, if I can, my low back kind of pushing gently into the floor. And I want to feel very minimal, if no movement of the shoulders upwards. So I don't want to see that. You can kind of just place your hands here on the neck, just gently. I don't want that moving a whole lot. So here's an upper chest breath. That's not what I want. You can see I'm kind of hollowed here. I want to try and expand and contract. So our 1 rep max breath, I'm going to show you just one, then we'll go into 20, and then I'll show you the down regulating breath, and then I'll go through a whole cycle that you can follow along with. So I'm going to inhale. So this is the one time that we're going to allow an exhale through the mouth. Because it's going to allow us a rapid recoil, we're going to get more motion faster. So on this rapid 1 rep max breathing, we're going to get big motion and more rapid motion. And then we're going to slow things down, and it's going to be only through the nose. So my down regulating breath is going to be an inhale for a count of 3 to 4. Breathe, hold, and a slow exhale. You're going to try to elongate that exhale as long as you comfortably can, and then inhale. If on that inhale you feel like you got to inhale rapidly because you really need to breathe, you might have held just a little too long. So exhale as long as you can for a nice, comfortable, soft inhale. Okay, so that's our reset. We got 20 rapid, full, as big as we can inhales and exhales. We have a hold, and then we have 5 to 10 slow down regulating breaths. So here we go. That's 10. Really trying to move through my hands. As big as I can, as much out as I can. 5 more, really get as much as you can. Last one. Hold on the exhale. I'm just going to let my hands relax. I'm going to hold as much as I comfortably can. Inhale slow. Exhale even slower. Inhale slow. Exhale slower. Inhale slow. Exhale slower. Last one, nice long slow inhale. Last exhale, nice long slow exhale. All right, so that's our breathing reset. That's one cycle. We got 20 rapid inhales through the nose, big expansion, exhale through the mouth. Then we got a max breath hold on our exhale. And then we got 5 nice slow deep breaths with our long in exhale. So give that a shot. It can really change how the low back is feeling, how the neck is feeling, sense of stress, perception. Only takes about 2-3 minutes. You can repeat for as many cycles as you want. If you get lightheaded at all, we're just breathing. And so that's probably your body saying, hey, I'm not used to either this much oxygen, this kind of buildup of carbon dioxide, whatever it is. And so if it feels sketchy, it might be sketchy. But if you're laying down, this is perfectly safe. We're just breathing. And so just kind of explore and just pay attention to what you're feeling. Give that a shot, our max or our breath reset.